In Pune, last few days, there is a lot of cold. And the smog has increased. And I am seeing a lot of emergency cases in the night also, in the early morning, because of the smog that traps the pollutants down. And these are at inhalation level. And then they trigger the underlying allergy, asthma, inflammation, including the skin allergy, eye allergies, as well as bronchitis. In air, these pollens can travel kilometers together. Cat and dog danders can travel from somebody close to another one, and they sensitize the person. And these days, the flower pollens, as well as the insects, the droppings and their feathers, they cause a lot of trigger. The primary inflammation by proper modified standardized skin allergy testing and desensitization or immunotherapy or allergy vaccine shots, we call it, can develop a tolerance to those allergens, and the patient has a very good quality of life. It controls the symptoms fast. It prevents the progress of the disease and new sensitivities which may develop later on. Suppose the patient is allergic to some dust mites. Cross sensitivity may increase and he will have multiple allergies. So we should prevent that with the proper allergy management. And allergy testing should be done after the proper allergy expert guidance. As an allergist, we properly examine the patient, take a detailed history, according to allergist point of view, and select the allergens whichever are required. And after once the allergy report comes, amongst that, whichever required, we have to desensitize against some of them so that they have a cross reactivity, and the desensitization can help to the other allergens also. Now there are a lot of confusions amongst the people, like is it curable, is it 100% and all. See, most of the patients with this management have a very good response and recovery. Each and every patient is different. So we have to manage it according to that. Some of the patients may require a moderate common or less common allergens, because initially we always check the most important allergens rather than going for all the panel of tests. Again, the underlying inflammation is a process. One fine day, the body shows allergy attacks. So patient always is confused, like why on the same day, or why I am having this problem the last 2 years or 6 months and all. But the sensitization or the continuous inflammation into the body is because of the air allergens or food or some of the drugs and some of the chemicals. They can cause a inflammation regularly. So the proper management can help a lot. Like, is it required for each and every patient to go for the allergy tests and desensitization? Yes, absolutely. Because in 2013, the data shows 40 million, 4 crores people are suffering with 400 million, like 40 crores people are suffering with allergy. And now if you see 2018 data, the COPD is the second chronic disease after the heart disease. And it is the third leading cause of death in India. Even it has crossed to the diabetes, it has crossed over to the cancer amongst the diseases. And so allergy, asthma, COPD, there is an overlap syndrome. And if you don't manage the allergy, these people will be going into the chronic respiratory distress. And then the complications because of some viral infection or dengue can be there, and the patient gets admitted in a severe attack. So we have to manage the allergy in each and every patient.